Hi everyone, good afternoon, and thank you for coming on board. It's great to be on Facebook Live with Iron Hospital, and our topic today is going to be new frontiers in weight loss treatment. In the 6 months that I've been here, we have had several new developments in weight loss treatment that we offer at Iron Hospital. Of course, we perform a lot of our conventional treatment, which includes surgeries and operations, and we have concluded quite a lot during the time that I've been here. And it's great to talk to you now about the new treatments that are available in weight loss treatment, and I hope that you will find it very beneficial. So we are coming to the end of 2020, and what we can see here is basically in 2020, even though we have been affected very much by COVID, it is a year where medical advances have happened tremendously. So it is similar to times when countries go to war. So when countries go to war, the advancement of technology in weaponry becomes very fast at that time. So we are at war with COVID now. So when we are at war with COVID, we need to have new weapons to combat COVID. And the only way that we can do that is by coming up with new treatment. And it is a pleasure for me to introduce all these new treatments with regards to weight loss, which has happened very recently in Malaysia. And I'm very proud to announce that we have these treatments in Ireland Hospital. Okay. This is our topic, and it will be new frontiers in weight loss treatment. And basically, for those of you who do not know where I'm from, again, I'm from Langkawi. I come from a very small town, Budak Kampung, and nothing very fancy. And I have very close ties with everybody there, and I still have what you call it, very close relationships with my patients there. But basically, I was born in Ipoh, went to normal school, no special school, no private school, not much tuition. And I finished my MBBS locally, and I did a lot of my fellowship in Taiwan actually. I've been serving as a surgeon from actually 2011 until 2020, which is almost 9 years in Langkawi. And I've got experience in a lot of states and a lot of places like Sabah, Langkawi, Ipoh, and Penang. So what are the services that I do? So normally I am a general surgeon and also an adult laparoscopic surgeon, in which I manage most of the adult problems, which include lumps and bumps, hernias, thyroid, cancers, gallstones, circumcisions, hemorrhoid, and any of the emergency stuff. But I have a niche area in weight loss. That means I do all these procedures in general surgery and in minimal invasive surgery, meaning with the laparoscope, just like any other general surgeon. But I've got a niche area in which I like doing a specific aspect, and that niche area is actually in weight loss. So, now, ladies and gentlemen, why is obesity a problem? Obesity is a problem because until now, we have this stigma that obesity is a cosmetic problem. All right. I want to stress here that obesity is not a cosmetic problem. It is a medical problem. It is the same as someone having hypertension, diabetes, joint problem, autoimmune diseases. Obesity is a disease. It is not a cosmetic problem. So, because we have this belief that obesity is a cosmetic problem, there is very little initiative from the government to actually deal with it, because it is more of a looks kind of a thing. Tetapi in reality, obesity is not. It is a medical problem. And if we do not manage this problem, obesity leads to a lot of other issues, namely medical problems like hypertension, diabetes, joint problems, infertility, which I am getting a lot these days, as well as other mental issues like stress and depression. So we have to understand that obesity is not just one paradigm where your stomach is big or you have a lot of weight and all that. It is an entire complex that basically involves a lot of other diseases as well. The other problem we have in Malaysia is we have a lot of good food lah. Our food is very rich and very sedap and very good, and it's very difficult for someone who really wants to diet in this country, in Malaysia, to actually diet. You take an example for a school child who goes to the canteen. In the school canteen, it is very difficult for the child to access healthy food like fruits, vegetables, as well as healthy juices for them to consume. They normally have one stall selling Malay food, nasi lemak. They normally have one stall selling Indian food, roti canai, or mama food, roti canai. They have one stall selling Chinese food, char kway teow or chi chong fan. Then they have a drink stall selling heavily sugared drinks. So this is an example of an environment that is not conducive for our children to actually eat healthily. And I see more and more of these problems with our children because now I find that I am getting more and more referrals from pediatricians, from older children who seems to have obesity problem, and they already have medical problems related to obesity. So this is a very serious aspect of obesity. What has happened over the past couple of months, I would say, since February until now, is a lot of us have been stuck at home, MCO again. So when we are stuck at home, we have very easy access to food. And now we have got food delivered to our doorsteps, Food Panda, Grab Food, and now you got new, even Air Asia also wants to do food delivery. So the choices are too much and too easy. So we find that Malaysian obesity rates have gone up. When the obesity rate goes up, the problems related to obesity also goes up. And one of the most stagnant or one of the most apparent yang paling ketara problems with obesity is mental health. We find that a lot of our patients now are coming with depression and anxiety, and this runs in tandem with them gaining weight. So this, ladies and gentlemen, is a big problem. So we have to deal with obesity like it is a disease. So let's talk about how we are different from the Matsale lah, the orang putih, the angmos, and the white guys lah. So the orang putih, they are bigger, and when they are bigger, they become obese at a higher weight. But we as Asians, we have a lower weight, but we are classified as obese, same like the orang putih at a higher weight. So if the orang putih is, just say we have got Mr. Joe. Mr. Joe is 110 kilos and he has all the problems related to someone being 110 kilos. Then we have got Inche Ahmad. Inche Ahmad is only 95 kilos. But Mr. Joe is 6 feet 2. Inche Ahmad is 160 centimeters. So even though Inche Ahmad doesn't have as much weight as Mr. Joe, Inche Ahmad still suffers from all the complication that Mr. Joe suffers from. So we have to manage weight reduction at a lesser weight as compared to our Matsale counterparts. And this is a list of all the problems related to an increased weight: heart disease, high blood pressure, high cholesterol, hypertension, triglycerides, ovarian infertility. I find that I'm getting a lot of referrals nowadays from couples who are newly married and unable to conceive and who are overweight. And they come and see me for operation for obesity, and many of them after the surgery are able to conceive. So how can we overcome this problem? You can try lifestyle approach. That means you go on a completely different way of looking at the way you eat and the way you have your life. For example, you come to work every day by car or by Grab. You park your car, you come to work, take a lift to your job, sit down, wait until 9:30, go for breakfast, come back, sit down in your office work, finish up until 4:30 and go back. So you change your lifestyle. Come to work, you walk, you run, you cycle to work, no car. Difficult to do. You don't take the lift, take the staircase to work. And at work, you skip your breakfast or you have a very light breakfast and you do some exercises in between. So these are dramatic lifestyle changes that can help you. Second, diet. Now, I have talked about diet extensively and I find that there are many diets available. You have intermittent fasting, keto diet, you have got what you call it, the calorie counting diet, and you've got so many diets in the market. I find that diet is something that is specific for specific people. Non-exercise activity thermogenesis NEAT, such as intermittent fasting, exercises, medications, and of course, we have as bariatric surgeons, bariatric surgery. So at Island Hospital, I don't manage patients who have weight problems alone. We have a team around us. The team consists of me, the endocrinologist, bariatric nurse, psychiatrist, and a bariatric coordinator. So the patient doesn't only get an input from me, the patient gets an entire package around the bariatric services, and therefore it is very, very value for money. We have a few procedures: intragastric balloon, which I will talk about, gastric bypass, sleeve, and medication. So let's talk about an example. Katakan you have a 38-year-old woman. She's very tall, 178 centimeters. Her weight is 105 kilograms. BMI therefore is 33. Comorbids may be hypertension, diabetes, emotional problem, don't want to go out because big size, kan, not happy, don't want people to see her being a big size. These are the type of patients that are actually not very heavy for surgery and not actually too light that we don't do anything for them. We must do something for them. And these kind of patients, normally, I will advise them for lifestyle modifications, and also I will initiate some medical treatment, which is pharmacotherapy. And I'm glad to say at Island Hospital, we have a range of pharmacotherapy that can help you lose weight. That means we have ubat medication that can help you lose weight. And these medications are labeled and indicated for weight loss. And not many centers have it, and we have it at Island Hospital. We have bariatric surgeries, and we have other approaches which I will talk about as well. So, ladies and gentlemen, to gain weight is natural, but to lose weight is very unnatural. That means it's very easy for someone to gain weight. All they have to do is just do what they are doing on a daily basis, natural. But to lose weight is very, very unnatural. It requires a dramatic intervention at that particular time for them to lose weight. That is why when you see on the internet, you see some people on Facebook, on TikTok, on Instagram, oh, my weight loss journey over 3 months. You can see that they lost a lot of weight. But you have to see what happens to them 6 months later that they don't show. So, because it is a very natural process to gain weight again if you don't stick to the same regime. Okay. I cannot move the slide forward. Okay, sorry. So, all right. So, what about human biology? Now, generally, if you have a set weight, just say lah, you are 75 kilos. Make it more lah. Let's say you are 90 kilos, and you want to lose weight. So, what do you decide? I have to exercise more and eat less. This is what you tell yourself. But your body doesn't understand this. So when you eat less, your body understands that it is getting less fuel. When the body gets less fuel, it processes the fuel not as effective as when you add more. So the body becomes slower, your metabolism becomes slower. So you don't lose weight actually, the body just processes the food slower because the body has got a set point to defend the highest weight. Then you exercise. When you exercise, you feel that you are burning fat, but actually your body will send out all kinds of hormones to preserve as much fat and energy as is possible in your body. So the body's function is always to defend the highest weight. So if you want a diet or you want to lose weight, it must have one very important element, and that important element is consistency. So we have to be consistent when we want to lose weight. That is the only way the body can dysregulate and you can lose weight effectively. So let's look at this study here. So we examine 181 patients. We find that with lifestyle modification, they can lose weight over 6 months. In fact, they can lose 14%. But normally, almost all of them regain the weight later. Okay. So why is this so? Because obesity is all in the brain, and you have got obesity centers in your brain which you cannot control. You have got a mesolimbic reward system that rewards you when you eat. That is why when we go out and we have that very sedap plate of rojak, we feel very good. It reminds us of the happy memories that we have in our childhood when we used to eat it with our family, with our friends, because our brain secretes the same hormone that gave us happiness before, it secretes it again when we eat that type of food. So the obesity system is actually very tricky. Dia orang kata sangat mudah untuk menipu kita. So when we eat, it is not only the food is nice, it makes you feel nice. It makes you feel happy. You are contented, and this is because your body is rewarding you to feel that way when you eat food. So what do? You want to replicate the process. Everybody wants to be happy, so you eat more and more. But this system is very funny. It triggers happiness when you eat maybe the first bite, but subsequently it triggers less and less and less. So you have to understand that when you want to lose weight, you are fighting all these elements. So it is good if you can have help. So in our hospital we have liraglutide. Liraglutide is actually known as Saxenda, and liraglutide is proven to actually produce about 8 kilos of weight loss between 6 months in the 6 months cohort. And if you couple it up with our multidisciplinary team, which is our dietitian and our physiotherapist, you can lose even more. I've had a patient who came to me on Saxenda and has lost about 18 kilograms actually. Very good result. And she doesn't need any other intervention. And then what we do is we put her only on a dietary and physio team, and she can maintain the weight, and she has maintained it now for about 6 months. So let's talk about what is exciting now. So as usual, people don't like operation lah. They don't like surgery because surgery is very invasive. We have to cut someone. Even though I always tell my patients, our surgery for bariatric is actually not very invasive. We make only small holes, and normally you can go back after 1 or 2 days. So it's not something very dramatic lah. You come and see me on the day of surgery, we check you up, we do the operation. Tomorrow you're well, you can go back. But now we have a new technology that is even better. So let me give you some history about this, tuan-tuan and puan-puan. So before, when I began my career in bariatric surgery, I used to insert this type of balloons into the stomach so that the balloon becomes big and people become full, so they cannot makan. And I find that it's very good because these balloons, when you put inside them, they tolerate it very well and they become thin. But the difficult part is, number one, when you insert, you have to do it by endoscopy. That means you have to go to sleep. I've got to put a scope into your mouth, into your stomach, put the balloon in and take it out. And then after 6 months, put another scope inside, take out all the water and take out the balloon. So it is a process where I have to do a procedure to remove. Now we have a newer balloon, it is a gastric balloon that you don't have to put it by endoscope, you only have to swallow. And it's very exciting because this balloon is swallowable. It's like a capsule you swallow. There's a wire outside. I'll show a video after this. And the wire gets filled with water. And then after 4 months, the balloon breaks, the water comes out, and the balloon comes out in the berak only. That means there is no scope procedure, there is no operation, there is no anesthesia. You don't have to be warded in the hospital. There is no, how do I say, it is not difficult lah. Dia mudah, it's easy. And you can come as an office procedure and you can go back to work after that. You don't have to take any leave. And this is the design of the balloon. So how it works is, the balloon is actually closed by a degradable filament. A suture holds it closed. And then after 120 days, the suture breaks. The filament opens and all the water goes out. The balloon shrinks and come out in the berak. So it's very good, because you don't need to have, like what I said, surgery. But not all patients are suitable for balloon. Some patients with BMI only about less than 32, between 28 to 32, that means if your weight is about 85 to 90 kilos or 80 to 90 kilos, in our normal Asian population, it's suitable for balloon. And we find that the balloon is very safe. Nothing is 100% safe. If someone tells you that a medication or a procedure is 100%, no side effect, they are lying. And the balloon is very safe, where our safety is up to 98%. And we have only a few problems in the world associated with intolerance. Patient cannot tolerate the balloon, so we manage it with a few medications. So far at Island Hospital, we have inserted quite a few now, and we haven't had any serious complications that we cannot manage. So this is how the balloon will look in X-ray when you swallow. You can see this film, this line, which is actually the tube attached to the balloon, and this is where the water comes in. All right, and this is what the balloon will look like in the stomach once it has been inserted. Okay, so you can have very good weight loss for up to 4 months. So why do we choose 4 months? We find that previously we had a different balloon called the Obera balloon, and the Obera balloon also is similar to this balloon, where you have about uh, weight loss over the course of 6 months. But we find that if you leave the balloon in longer, it doesn't have any benefit actually. So most of the weight loss occurs up to only 4 or 6 months. So it makes sense for this balloon to actually degrade in 4 months and then come out. So this will be a short video regarding the balloon, which I would like to show you.
The ellipse is a weight loss device that can be swallowed in a doctor's office without endoscopy or anesthesia. The ellipse is packaged into a capsule and attached to a thin, swallowable delivery catheter. The catheter is long enough so that once the capsule is swallowed, the balloon can be filled from outside the mouth. Once the capsule is swallowed and enters the stomach, it degrades. The ellipse can then be filled with 550 milliliters of fluid in under 10 minutes. After filling is complete, the catheter is detached and removed from the mouth. The ellipse fills the stomach and can assist you in feeling full and eating less. This leads to weight loss over the multiple months the ellipse is present in the stomach. While the ellipse is present in the stomach, you are encouraged to lead a healthier lifestyle and use the ellipse as a tool to assist you on your weight loss journey. The ellipse contains a release valve that opens by itself at the end of therapy, allowing the device to empty. The empty device is small and flexible, allowing it to transit the gastrointestinal tract until it is excreted. Speak to your doctor to find out if ellipse is right for you.
Okay, so ladies and gentlemen, however, our champion is still the surgery, because the balloon you can lose maybe about 10, 15, some even 20 kilos lah, and that depends on patient to patient. But our champion procedure is still the surgery. That means if you have excess weight and you need to lose a big chunk at one time, the choice is still operation, because nothing works as good as surgery. So the most common procedure that we do, especially at Island Hospital, is a sleeve gastrectomy, where we cut a portion of the stomach and we remove this portion, the big portion, and we leave only a small portion of about 145 mils in the stomach. What happens is this makes it difficult for patients to eat a lot, and also dysregulates all the bad hormones that are secreted in the stomach to make us hungry. So patients don't eat so much and they don't feel hungry so much. We also do what is known as a gastric bypass for patients with diabetes and hypertension, and we have done quite a few now already. And most of our bypass procedures are for patients with a high BMI, more than 37 or even 35, but with some medical problems lah. So we hope to solve their problems by doing a gastric bypass. This is an example of a patient of mine. So you can see after surgery, there are only 4 plasters, very small, on the stomach. So there's no big scar, and this is the stomach that we remove. And this is a patient of ours who is now lost almost about 60 kilos, and we are very happy with her progress. So, ladies and gentlemen, you have to understand that Malaysia is not the champion in many things, but unfortunately, we are the champion in obesity in ASEAN. We have the most obese population, and almost 50% of our population is overweight. And it is time that we realize that this problem is not a cosmetic problem, it is a medical problem. So, many people will ask me regarding insurance for bariatric surgery. Insurance for bariatric surgery is in the pipeline. We are discussing with our insurers, coming up with policy, and I hope next year we will get some favorable news on insurance coverage for bariatric surgery. But for now, there are 3 ways that you can pay for your bariatric surgery. One is withdrawal from EPF or KWSP. We have a easy loan method with a financial tech mechanism with Compare Hero, which is very, very good. and offers a very low interest rate and very easy repayment, and of course out of pocket expense. But as surgeons, we always want to help our patients. So however we can help you in reducing the cost, we will do it on our side. It is not about the fees, it is about helping as many people as we can. And I hope that this message goes across, that this surgery is not a surgery for the rich, or a surgery or a treatment for the wealthy. It is actually a treatment for everybody. And I hope that those who have these problems come and see us, and we can work out some solution for you, and try to find a balance where we can help you. So thank you very much. That is the end of my presentation. I think I took quite long, 30 minutes. We have a few questions. Number one is, how does COVID affect obesity? Okay, good. So as you know, recently Boris Johnson, the Prime Minister in UK, he got COVID, very bad attack of COVID. And the reason why his attack was very bad is because he's quite big size, he's obese. So we know now that COVID has got an affinity for a receptor in fat cells. So the more fat you have, the more COVID will go and attach to those cells, and the viral load in your body becomes more. Therefore, you become more sick, and the chance of you dying from COVID becomes more apparent. So definitely obesity has a problem in COVID, and it can cause more severe infections if patients who are obese develop COVID. So if you are obese in this kind of time, you have to be very careful in terms of following SOPs, wearing masks, washing hands, not going in close contact with anybody, and being as safe as you can. And you have to be extra careful, because if for some bad reason you develop COVID, the disease burden is heavier in an obese patient, and it becomes very bad. Okay. First question, can the balloon be removed early, and is it risky to do so? No. So the balloon can be removed early, but it's technically a bit challenging, because the film, the plastic film, is very thick. So you have to puncture it to release the water and then pull it out by scope. It can be done. I've removed two, and they are because patients can't tolerate, and also patients find it very, very difficult to manage the cramping that occurs on day one. We can control the cramping normally with medication, but these two patients are not very happy with it. They wanted it removed. Is it risky to do so? Like I mentioned before, any operation has got risk, but it is not something that is very risky or life threatening. It can be done. Is it possible to have more than one balloon in the stomach? Yes. So now we have got systems where you have got two balloons. In fact, now we have got a new system which has got three balloons. But conventionally, there is not much difference. But what you can do is, you can have one balloon inserted. After 4 months, lose weight. If you want to lose even more, you can have another balloon inserted as well. And that, we have about 2 or 3 of our patients who are keen in doing that, and who have done that and have lost weight. If I have a stomach condition such as reflux or abdominal pain, can I go for a balloon insertion? So if you have a stomach problem, normally what we do is, we do a scope first, OGDS, and we check what the problem is. If it is gastritis, normally we give some medication and we re-evaluate after 2 weeks. Normally we don't insert balloons into diseased stomachs. We manage it first, and then we put it in. Reflux is a very good question. If you have reflux, very severe reflux, it's very difficult for us to do a sleeve surgery for you, because the sleeve will make the reflux worse. You can do a bypass, but the sleeve will be difficult. A balloon will induce a bit more reflux, but we can also manage it with medication. Lately, I've had a patient who has had some reflux and who's keen for a balloon. We monitored him very closely before, after, and I've been keeping track with his progress subsequently, and we managed to control his reflux very well. And many a times, this reflux that gives you a problem with balloon is because of alcohol consumption. So if you are a heavy alcohol consumer, it is difficult to get relief from reflux, especially when you insert this balloon. Now, will I be able to get pregnant before, during, or after the balloon? Before, definitely you can get pregnant. During the balloon, you can get pregnant, but we would advise against it, because when the balloon is inside, your ability to consume will be less. Therefore, you will have a small nutritional deficiency. After the balloon is removed, no problem. We have had so many patients who have got pregnant after their balloons have been removed that I just can't remember how many the numbers are, and many of them are very happy and very successful in their weight loss, and also they can maintain their weight after their delivery and still remain thin. Will I be able to get pregnant? Okay, after my first balloon, how long must I wait if I want to get a second balloon? Okay, for the swallowable balloon, I would advise wait a month. The reason is because once the balloon comes out, you want to see how your stomach adapts and how you gain or lose more weight. If you continue to lose weight, you may not need a second balloon. You can just follow the regime that you are doing and then you lose more weight. But if you find that your weight is stagnant and you want to lose more, you can insert one. Or if you find that you gain weight and you want to insert a second balloon, is also no problem. So my advice is wait 1 month and then subsequently insert a second balloon. Can the size of the balloon be readjusted? Okay, so for the previous balloon that I used to insert, I can readjust the size. But for the swallowable balloon, you can't. It is 550 cc's of fluid and it is stagnant. The previous balloon, initially we can insert up to 500, and after that we can even insert up to 750 cc's. So it's a lot, but in the new balloon you cannot. And the recommended size is not like one size fits all, but generally we find 500 to 550 is just nice. We have more questions. In what cases would you recommend surgery over the balloon or vice versa? If your BMI is more than 33.5, it is difficult to manage with the balloon because the weight loss will be there, but it will not be enough to bring you to a normal healthy weight. So if your BMI is more than 33.5, it is better to have surgery done. In other words, if your weight is more than 90 kilos in a normal Asian height, it's better for you to consider surgery. You can consider balloon, but it is a bridging procedure. That means you take the balloon, lose some weight, and then come to us for surgery after. So, ladies and gentlemen, we've come to the end of our session. I don't think that there are any questions beyond this. Thank you very much for joining us online. I'm so happy to give this talk. And my take home message is if you would like some consultation or some advice regarding your weight, please feel free to contact us. You can contact us through any of the Island Hospital platform and make an appointment to come and see me. There's very rarely a long waiting time, and normally because of COVID, we arrange a very strict appointment based schedule, so you don't have to spend a long time in the hospital. I would like to say that even though the vaccine is out, we are not safe from COVID yet. You have to follow SOPs and remain safe. Wash hands as much as you can, wear masks, stay indoors, practice a very high level of hygiene, keep yourselves very clean, mandi selalu, and avoid crowded places and avoid close contact. If you can stay at home, stay at home. Finally, I would like to wish everyone a Merry Christmas, and I hope this joyous occasion will bring all of us together and we can put the difficulties of 2020 behind us and look forward to 2021. Happy New Year, everyone, and take care. Thank you. Bye bye.